Statistics show that doula services are effective in reducing stress and anxiety in expectant mothers, while improving birthing experience and outcomes. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, senior writer with AHA. In this Members in Action podcast featuring maternal and child health efforts, Aisha Syeda, program manager at the American Hospital Association, is speaking with Mary Schwaegerl, an obstetrics director, and Julia Yoder, a marketing and public relations director at Brookings Health System, as they share the impact of their volunteer doula program at Brookings New Beginnings Birth Center.
Thank you, Tom. Mary and Julia, it is our privilege to have you join us today. Let's begin. Will you tell us a little bit about the doula program at Brookings Health System? What was the impetus of beginning this program, and what does it look like now?
Yes, our first doula program was initiated in the fall of 2011 after a request from, we had a focus group that wanted to find out what our community wanted in a birth experience, and there was a high need and request for doulas, so we started a doula program. And for those of you that don't know, a doula is a woman who provides continuous labor support during childbirth, also works with the mother and her partner to assist with emotional and physical support, and uses relaxation techniques to help with positioning and massage. Brookings Health System was the first in the state to offer a free volunteer doula program. In 2012, we added a postpartum doula program, so we were the first in the nation to have a postpartum doula program.
And another important thing, too, is that birthing and postpartum doulas, part of the reason why we added this program is to help offer that constant and social and emotional support for mothers while in labor. That was part of the feedback that we had also received in the focus group from the community. And so when we're looking at the doula program itself, what we're looking for our criteria is that we want doulas who are currently licensed. We also ask if they don't have a current license that they attend a doula workshop, which we will host here at our facilities. And then we have to go through, of course, our typical volunteer requirements as well. So that includes like background screening and immunization records, covering HIPAA and understanding that. And then what we ask the volunteer doulas to do is to volunteer for either 2 12-hour shifts or one 24-hour shift each month for a year. And part of the advantage to the doula then is that they're going to receive their orientation and mentoring, especially the new doulas, by another doula for their first patient. So it's not like they're going to be flying solo their first time out. They'll have some of that mentorship under them to help them kind of learn. And then we also to offer ongoing education to our pool of volunteer doulas.
That's wonderful. How many doulas do you guys have in the program right now?
I think there's approximately 10. We started out with 20, but recruitment and keeping those doulas on is difficult, so we probably have around 10.
Can you share some impact the doulas have made on birth outcomes of your patient population?
Yes, that has been a real difficult area for us to collect data on. One of our problems or good points is that our facility has always had low C-section rates, and so prior to implementing the doula program, our C-section rate was 11% and now is still 12%. So we can't really use our C-section rate statistically to say that it's decreased those rates. So one thing that we did work with our local college, SDSU, and they did a study for us from the Women in Giving program and South Dakota Foundation and Rural Health Center. They did a study in 2012, and it was to evaluate our program. And one of the questions asked to the doulas, what are your motivators? For them, the motivators would be their personal birth experiences, desire to help other women, desire to understand a range of birth approaches, and a desire to gain experience working in a hospital or birth environment, so that would be your students. Professional benefits such as skill development for clinical work, and also to help build private practice with referrals or moms, those doulas that wanted to start their own practice. Also, another question that results that we got patients' positive experiences with doulas. They stated that they had added emotional support, allows the partner support and closeness, and shows him how to help her, helps with the patient's empowerment. And Julia, you had a personal experience with a doula.
So I actually had my first baby 6 years ago in our facility. And at that time, I chose a doula. And of course, I was planning, a regular, normal delivery and that type of stuff. And when I thought about it, I actually had done some interviews with some patients who had delivered at our facility before, and they used a doula. And when I asked them why, they said, well, part of the reason is that, we want to have as natural of a birth as possible and try to do it without pain medication. And so one of the reasons that they had chosen a doula was to help with that pain relief. And so when I thought about it as a mom myself expecting, I liked that idea and that concept. And so when my husband and I came in then to our OB unit here at Brookings Health, that was one of the first things I asked for, is I asked for a doula. And so they called a volunteer doula. She came in. Her name was Jenny. I was in labor for 16 hours. And she was there with us the entire time that we were in labor. And so I got stuck at 6 centimeters. And so she was there helping us to try to get labor progressing and labor moving. And so doing things like, okay, let's try a birthing ball. Let's try this position. Let's try that position. It was beneficial to me on a personal level with that. But when things were closing in on that 24-hour window, because I was also strep B positive, and it was getting to the point where we had to do a C-section for the benefit of my baby, at that point, Jenny also came down to our OR, and she was allowed to be in our OR and also be there during my C-section delivery. And so she was there for me during the postpartum portion of that too as well. And she was able to help me initiate breastfeeding, helping me to hold the baby, because, when you got that big C-section scar and that type of stuff, it was really advantageous. And having had that experience now as, in my role as marketing and PR director for the health system, when I interview moms who have had a doula and opted for a doula, a lot of times they'll say similar things, is that, they really appreciate having that extra person there. Some women say it's because their husband or their partner maybe doesn't know exactly what they should be doing at that moment, because let's face it, this is a first-time experience for a lot of them too as well. And so, they may not be the old pro that gets like, this is the moment that I should be holding her hand or doing something like that. And so a lot of times that's what our volunteer doulas can do as well, is just help bring that emotional support and really bring the dads into the experience as well.
One other point from the study, going back to our study, we wanted to know not only how are the patients perceiving the doulas, what's in it for the team members, the nurses, the doctors. So some things that came out of, positive notes that came out of the study, the staff members felt that the doulas were non-intrusive team players. They really felt our volunteer doulas were respectful of hospital policies and norms. They were helpful in supporting the nurses, and they were a common presence with patients. And so these doulas have really helped our staff and really have become part of our team.
That's wonderful, and thank you so much for sharing that story, Julia. I think those are impactful stories, are the stories that we'll need to tell to increase access to doulas in various communities, in various hospitals and health systems. Which leads me to my next question. With the COVID-19 pandemic, how has the program changed or evolved to meet the needs of the patients during this time?
Well, I think the COVID pandemic took all of us by surprise. A1, our professional organization for obstetric nursing, does support the doula services in this pandemic. They feel they're professionals and they should be treated as a healthcare professional. That being said, we have a pause on our volunteer doula program, not because of our concern for our patients, it's our concerns for our volunteer doulas. They have family members at home. that they're trying to take care of, and we want to make sure we're taking care of them and don't want them to be exposed. They are such a strong team, though. They recently came about and said, you know what, we're ready to do this. We can do this. And so they want to get back in the force. So we're working on a plan to get them back on our volunteer services. So they're so committed. They want to be there for the women to help. Also, during the pandemic, if a patient does have a doula that they're already working with, that doula is welcome to come in to our facility and support that patient.
That's great. What are some of the lessons learned since the beginning of this initiative? What were some of the challenges, some surprises, whether from the start of the initiative or during the COVID-19 pandemic?
I think first off, at the start of the program, if anyone's going to start a program, I think it'd really be wise if they could develop some form of data collection. You need to compare, how is this program working? That's why we had SDSU do the study for us. But if you can come up with some data to start collecting, like number of patients served, I think that would really be helpful to analyze how your program's going. The other thing throughout the program that we've always struggled with is maintaining a high recruitment of candidates for the doulas. Our lessons learned, there's pros and cons. With SDSU, our college here, we use the nursing students at first. The motivators for them would be lessons learned on OB. It's a great thing to have on your resume. The minus with students is it was difficult for them to sign up for shifts. They were not always committed like we want them to be. Some of the women that we chose were then from our community. Plus for them, they're more motivated. Their decision to become a doula seems to be driven from their desire to help other women. Minus for them, it's difficult for them to give up their time due to their own child care needs. So I think lessons learned, if you start a program, you need to focus on what motivates doulas. That way you can help maintain a high recruitment of women. And we found you need to have a doula champion. You need to focus on the personal development of that doula, include volunteer doulas at prenatal classes or any aspect of that patient care so we can introduce them to our clients and patients. And then widen that audience to expectant parents at anything that we can.
A couple of other lessons learned that I would kind of include in there too. Mary talked about how we're including volunteer doulas at prenatal classes to help introduce them to patients. And so part of it is that, when couples are expecting or mothers are expecting, sometimes they don't even know what a doula is and what the service can do for them. And a lot of times just introducing that to them that way helps to get the word out there and helps to build the program some. And I think that also helps for our doulas who have committed to make them feel like, they're being better utilized, not just by the facility, but by patients in general, in meeting one of their goals of serving the community. To that end, too, another thing that we have done is that we've done testimonial videos with moms who have used doulas, again, to help educate the community about the service and the fact that we have it there, and for those same goals as well, to help get better utilization of the doulas, help our doulas feel like, yes, we do value you and the time that you're putting into this, and also so that way they can help hear from the moms, too, about the benefits that those moms are receiving. Another thing on the lessons learned is that when we first started doing the classes for the doulas, hosting them here, we had them here free as long as those individuals would volunteer to be a part of our doula program. Well, what we found is that sometimes people weren't taking them necessarily as seriously as they should be because they were not paying for those classes and that type of stuff. And so instead, we've actually gone to a charge model where they're paying for the classes and then being asked to volunteer. And instead, we're putting in that benefit of when they volunteer, we're giving them that firsthand experience. We're promising them that they'll be mentored by another experienced doula on their first births to help them get some of that experience behind their belt so they're not so wet behind the ears. And that seemed to be a little bit more productive with the quality of the doulas that we've been able to then recruit and retain.
Yeah, the lessons you learned throughout this program sort of sounds like action steps that other hospitals can use to develop their own. So thank you for sharing that. And my last question to you, both of you, is how do you see your program growing or evolving in the next couple years? What's the future goal for you guys?
I think our continued goal is just to find innovative ways to keep the service available to our patients cost-free. We have a lot of patients who can't afford a doula, and so we need to focus on the doulas and keep them involved with their desire to help women.
And that's one thing that Mary mentioned, is that it's cost-free. You know, when you actually are paying for a doula, you know, that doula a lot of times is there with you throughout your entire pregnancy, and so there's some added benefits there. And so it's a little bit of, you know, you get whomever is on duty at that time, whoever is on call or on shift. It could be considered a drawback from some women. Some women like the idea of a doula, and they decide instead to hire a doula. And so if they come to us and they ask for recommendations of doulas who they can hire, we have that pool of volunteer doulas who are already working for us, and we can say, you know, well, here are some individuals who you can talk to and interview with on your own to see if that's somebody who you want to have with you through your entire pregnancy. But for those who can't necessarily afford the doula, they still have the benefit of having someone there to help them through the experience.
Mary and Julia, thank you for sharing your insight on the doula program at Brookings Health System. This has been an outstanding example of how engaging mothers and families and partnering with community resources can improve safety and outcomes for mothers and babies. For more podcasts and additional tools, including education to improve outcomes for mothers and babies, please visit our website at aj.org. This concludes our discussion today. Thank you for listening.